Turmeric is the most searched herb on the internet. More people are typing turmeric benefits into a search engine right now than any other plant on earth. The claims they find are extraordinary. Cancer prevention, Alzheimer's protection, depression, arthritis, heart disease. Over 15,000 peer-reviewed papers, more than 120 clinical trials. Here is the honest part. Some of those claims are backed by real evidence in real people. Not cells in a dish, not mice. Controlled trials. Others are completely fabricated, not exaggerated, fabricated, marketing copy that has never been near a clinical trial. And then there is a third category, the largest one. Claims that are biologically real, but that almost nobody achieves in practice because of one specific documented problem with this compound that the supplement industry has no incentive to tell you about. That is what I'm going to tell you today. Nothing here is medical advice. I will flag exactly where your doctor needs to be in this conversation. Let's go. Turmeric is Curcuma longa, a rhizome, a root-like stem that grows underground, a member of the ginger family, native to South Asia, used as a spice, a dye, and a medicine for over 4,000 years. The yellow that stains your cutting board for 3 days. Inside that rhizome are hundreds of bioactive compounds. The one that gets almost all the scientific and commercial attention is curcumin. Curcumin is the pigment that makes turmeric yellow. It makes up approximately 3 to 5% of turmeric by weight, not 50%. Not the dominant component, 3 to 5%. This distinction matters immediately. When you read turmeric research online, you are almost always reading research on isolated curcumin, not whole turmeric root. When you buy a supplement labeled high-strength turmeric, you may be getting a standardized curcumin extract, or you may be getting ground-dried rhizome, which contains far less. The label does not always tell you which. Curcumin and turmeric are not interchangeable. Research on one does not apply to the other. Keep that clear. Every claim in this video depends on it. The reason most of what you have read about turmeric is inaccurate, not always dishonest. Inaccurate, because of what happens to curcumin between the moment you swallow it and the moment it reaches your bloodstream. Almost nothing. Curcumin is fat-soluble. It does not dissolve in water. It degrades rapidly in the digestive tract. It is metabolized and eliminated before it can accumulate in tissues. A 2017 review in the Journal of Medicinal Chemistry examined the complete body of curcumin chemistry evidence. Their verdict? Curcumin is unstable, reactive, and non-bioavailable. A highly improbable lead for drug development. Practically, you can swallow a standard curcumin capsule with water and absorb almost none of it. Studies show that even at 12 grams per day, standard curcumin produces minimal detectable increases in blood levels. Most of those 15,000 studies were conducted in cell cultures or animal models. The compound applied directly to cells or injected. In those conditions, curcumin does extraordinary things. In your digestive system, with a standard capsule and a glass of water, most of it never arrives. This is not suppressed information. It is in the peer-reviewed literature. It is why so many clinical trials for systemic conditions have failed. The solution is piperine. Piperine gives black pepper its heat. A 1998 clinical study found that 20 milligrams of piperine alongside 2 grams of curcumin increased bioavailability in healthy volunteers by 2,000%. 2,000%. Piperine blocks the liver enzymes and gut transporters that eliminate curcumin before it can act. This is why every serious turmeric supplement now contains black pepper extract, listed as bioperine or piperine, and why traditional Indian cooking has combined turmeric with black pepper for centuries before anyone knew why. If you are taking curcumin without piperine and without fat, you are absorbing a fraction of what you paid for. Two other delivery technologies with real evidence: phytosomes, curcumin bound to phospholipids, the most studied form is Meriva, and liposomal preparations. Both improve absorption significantly. Both carry the safety consideration I will cover in full later. Every claim that follows needs to be read through this filter. Which form was used at what dose with what delivery strategy? If the study does not specify, the result may not apply to what you are taking. Now the claims, starting with where the evidence is strongest. Joint pain and osteoarthritis. Meta-analyses of randomized controlled trials, more than 800 participants with knee osteoarthritis, found that turmeric extract at approximately 1,000 milligrams of curcumin per day produces meaningful reductions in pain and improvements in function. Several trials compared curcumin directly to ibuprofen. Honest summary: curcumin is less effective for acute pain relief, but better tolerated. Fewer gastrointestinal side effects. One non-inferiority trial found a bioavailable turmeric extract comparable to paracetamol on several functional measures. Research suggests benefit. Research does not confirm treatment. That distinction holds across everything that follows. Anti-inflammatory mechanisms. Curcumin inhibits multiple inflammatory pathways simultaneously: NF-kappa, B, COX-2, prostaglandin synthesis. A meta-analysis of randomized trials found it effective in decreasing tumor necrosis factor alpha, a key mediator in many inflammatory conditions. The mechanism is real and well characterized. The clinical translation is condition-specific and dose-dependent. Anti-inflammatory activity in a cell culture is not the same as benefit in a human being with a chronic condition. Radiation dermatitis, the strongest clinical finding in this video. A randomized, double-blind, placebo-controlled trial in 30 breast cancer patients. 6 grams of oral curcumin daily throughout radiation therapy. Results: radiation dermatitis severity. Curcumin 2.6 versus placebo 3.4, P equals 0.008. Moist desquamation. Curcumin 28.6% versus placebo 87.5%, P equals 0.002. A 2024 systematic review in Frontiers in Pharmacology confirmed curcumin reduces oral mucositis severity in head and neck cancer radiotherapy patients. The NCI states directly, early phase trials have demonstrated delayed onset and reduced severity of mucositis and reduced severity of radiation dermatitis without significant adverse effects. These are not theoretical benefits, actual controlled trials, actual patients in active treatment. 2 caveats. For most people watching this, radiation dermatitis is not relevant. And if someone you know is in active cancer treatment, do not add curcumin without their oncologist knowing. I will explain why in the safety section. Metabolic disorders. A scoping review of 389 clinical trial citations found beneficial effects in 75% of studies examining obesity-associated metabolic disorders. Suggestive, not confirmed, promising enough to keep studying, not strong enough for therapeutic claims. In 2017, the Journal of Medicinal Chemistry published a paper that the curcumin research community is still debating. Title: The essential medicinal chemistry of curcumin. Central conclusion: curcumin is a highly improbable lead for drug development. The researchers classified curcumin as a PAINS compound, pan-assay interference compound. In plain terms, curcumin tends to show apparent activity in laboratory screening tests, not because it genuinely modulates those targets, but because of its chemical reactivity. It interferes with the assays themselves. Positive results in cell screening may not represent real pharmacological activity. The paper reviewed more than 120 clinical trials of curcuminoids across multiple diseases. Finding: no double-blinded, placebo-controlled clinical trial of curcumin has been successful for treating systemic disease. None. What does this mean accurately? It does not mean the osteoarthritis or radiation dermatitis evidence disappears. It does not mean curcumin is inert. It means the mechanism the supplement industry sells, swallow a capsule, absorb curcumin systemically, treat serious chronic disease, has not been validated. The laboratory evidence is not the human evidence. With curcumin, that gap is unusually stark and unusually well documented. Both of those things are true. Let me go through the big claims one by one and tell you exactly where each one stands. Claim 1. Turmeric treats cancer. In a laboratory, curcumin does kill cancer cells. That part is true. But killing cells in a dish is not the same as treating cancer in a human body. Every cancer drug candidate starts in a dish. Most never make it to a treatment. No clinical trial has shown curcumin treats or prevents cancer in people. Not one. The one cancer-related finding that is real: managing radiation side effects. That is a very different claim from treats cancer. Claim 2. Turmeric prevents Alzheimer's. Curcumin barely crosses into the brain. Early trials in Alzheimer's patients found no benefit over placebo. Researchers are still investigating with newer formulations in smaller studies. Where this stands today, not proven, not ruled out. Unknown. Claim 3. Turmeric treats depression. There are a small number of trials suggesting curcumin may have an antidepressant effect. The word researchers use is suggestive. The studies are small. The results have not been replicated at scale. Possible, not proven, and not a substitute for professional care. The pattern across all three is the same. Curcumin does something interesting in a laboratory. That something has not translated into a proven treatment in a human clinical trial. 1 fatality, 18 liver injury reports, 2 government advisories. This is the section the supplement industry hopes you skip. Liver injury. In 2023, Australia's Therapeutic Goods Administration issued a formal safety advisory covering reports spanning 2002 to 2023. Health Canada mandated updated warning labels on all licensed turmeric products. Signs to watch for: yellowing of the eyes or skin, dark urine, nausea, vomiting, stomach pain. Stop immediately and see a doctor. 18 cases over 21 years is a low absolute rate, but the cases are concentrated in people taking high bioavailability formulations, the phytosome and liposomal products. The NCCIH states it directly. Liver damage has been reported specifically in people using these more bioavailable forms. Higher bioavailability does not mean safer. For some people, it means the opposite. Liver condition of any kind, speak with your doctor before taking any curcumin supplement. Warfarin and blood thinners. Curcumin slows the body's clearance of warfarin. Warfarin has a narrow window. Small changes in blood levels stop the drug working, or raise bleeding risk sharply. There are documented cases of dangerously elevated INR in patients who added turmeric without telling their prescriber. On warfarin or any blood thinner, tell your prescriber before adding curcumin. Statins. Curcumin may raise statin blood levels by slowing their breakdown. Higher levels increase muscle pain and weakness risk. On statins, speak with your doctor or pharmacist first. Sulfasalazine. A clinical study found sulfasalazine blood levels 3.2 times higher, alongside 2 grams of curcumin daily. Flag this with your prescriber. Chemotherapy. Curcumin interferes with enzymes that process cyclophosphamide and doxorubicin. In active cancer treatment, the oncologist needs to know about every supplement, every one. Pregnancy. Avoid concentrated supplements. Cooking with turmeric is a different category. Symptoms. Stop and call your doctor if you develop yellowing of the eyes or skin, dark urine, unusual fatigue, nausea, upper abdominal pain. 4,000 years of cooking with turmeric does not predict what happens when you take a concentrated supplement every day for 6 months. The spice and the supplement are not the same thing. How to use turmeric, not what the marketing says, what the evidence supports. As food cook with it, 2 rules that matter. Use black pepper in the same dish. Piperine genuinely increases curcumin bioavailability from food. Traditional Indian cooking has done this for centuries. Now we know why. Cook it with fat oil, ghee, coconut milk. Curcumin is fat-soluble. It absorbs better from a fat-containing meal than from water alone. As a supplement, standard curcumin capsules without an absorption enhancer, poor bioavailability, weak evidence, poor use of money. You need a formulation that addresses the absorption problem. 3 options with documented evidence. Piperine, look for bioperine or standardized black pepper extract on the label. Piperine is the most well-documented strategy. Phytosome, Mariva, is the most studied. Curcumin, bound to phospholipids for better absorption. Liposomal, effective, but carries the highest association with the liver injury reports. Proceed with more caution. What the evidence supports at what dose joint pain trials. Approximately 1,000 milligrams of bioavailable curcumin per day. Radiation dermatitis trial, 6 grams per day. In a supervised clinical context only, not a home dose. The NCCIH position, conventional curcumin formulations are likely safe for up to 2 to 3 months as directed. Long-term safety data for high bioavailability forms is not established. Start low, increase gradually. If you are on any prescription medication, speak with your doctor or pharmacist before starting. If you have a liver condition, do not supplement without explicit guidance. My grandmother put turmeric in everything. She was not wrong. She was working with an incomplete picture, without the mechanism, without the clinical context, without the drug interaction list. Modern research has spent decades filling that picture in. The gap between what the laboratory shows and what a standard capsule delivers is larger for this compound than almost anywhere else in natural medicine. That is the honest root of it. Not the hype, not the dismissal, just the evidence, looked at clearly. 4,000 years of traditional use is evidence worth taking seriously. It is not a substitute for reading the research. I'm Elias Ford. This is The Honest Root. See you in the next one.